Question 1. A patient is receiving clindamycin for a serious bacterial infection. What is the most significant side effect the nurse should monitor for? A. Hypotension. B. Diarrhea. C. Tachycardia. D. Seizures. Answer: B. Diarrhea. Rationale: clindamycin can cause C. difficile-associated diarrhea and colitis. The nurse should monitor for diarrhea, which may be severe and lead to dehydration. Hypotension, tachycardia, and seizures are not common side effects of clindamycin. Question 2. A patient is prescribed furosemide. What should the nurse closely monitor to prevent adverse effects? A. Blood pressure and electrolytes. B. Blood glucose and cholesterol. C. Liver enzymes and creatinine. D. Serum calcium and magnesium. Answer: A. Blood pressure and electrolytes. Rationale: furosemide is a loop diuretic that can cause hypotension and electrolyte imbalances, particularly hypokalemia and hyponatremia. Monitoring blood glucose, cholesterol, liver enzymes, and calcium or magnesium is not as critical. Question 3. A patient is prescribed azithromycin for a respiratory infection. What is the most important adverse effect the nurse should monitor for? A. Liver toxicity. B. QT prolongation and arrhythmias. C. Renal failure. D. Hypoglycemia. Answer: B. QT prolongation and arrhythmias. Rationale: azithromycin is associated with QT prolongation, which can lead to life-threatening arrhythmias. Liver toxicity, renal failure, and hypoglycemia are less common with azithromycin use. Question 4. A patient is prescribed warfarin. Which of the following lab values is most important to monitor for safe therapy? A. Platelet count. B. International Normalized Ratio, INR. C. Complete blood count, CBC. D. Serum potassium. Answer: B. International Normalized Ratio, INR. Rationale: warfarin therapy requires monitoring the INR to assess the anticoagulant effect and ensure the patient is within the therapeutic range. Platelet count, CBC, and potassium are not as critical for monitoring warfarin therapy. Question 5. A patient on ACE inhibitors develops a persistent dry cough. What is the appropriate nursing action? A. Continue the ACE inhibitor and reassure the patient. B. Stop the ACE inhibitor and notify the healthcare provider. C. Administer an antitussive to relieve the cough. D. Increase the dose of the ACE inhibitor. Answer: B. Stop the ACE inhibitor and notify the healthcare provider. Rationale: a dry cough is a known side effect of ACE inhibitors. The medication should be discontinued, and the healthcare provider should be notified for an alternative treatment. Antitussives are not effective for this specific side effect. Question 6. A patient receiving methotrexate for rheumatoid arthritis presents with fatigue and bruising. What is the most likely cause? A. Anemia and thrombocytopenia from bone marrow suppression. B. Hyperkalemia from renal toxicity. C. Hypertension from fluid retention. D. Liver toxicity from drug metabolism. Answer: A. Anemia and thrombocytopenia from bone marrow suppression. Rationale: methotrexate can cause bone marrow suppression, leading to anemia and thrombocytopenia. Fatigue and bruising are symptoms of these conditions. Hyperkalemia, hypertension, and liver toxicity are less likely in this context. Question 7. A patient is on beta blockers and reports feeling unusually tired, short of breath, and dizzy. What is the most likely cause of these symptoms? A. Hypoglycemia. B. Bradycardia and hypotension. C. Hyperkalemia. D. Dehydration. Answer: B. Bradycardia and hypotension. Rationale: beta blockers can cause bradycardia and hypotension, which may lead to dizziness, fatigue, and shortness of breath. Hypoglycemia, hyperkalemia, and dehydration are not typically caused by beta blockers. Question 8. A patient is prescribed rifampin for tuberculosis. Which of the following side effects should the nurse monitor for? A. Vision changes. B. Hepatotoxicity and orange-red discoloration of bodily fluids. C. Hyperglycemia. D. Renal failure. Answer: B. Hepatotoxicity and orange-red discoloration of bodily fluids. Rationale: rifampin can cause hepatotoxicity and orange-red discoloration of bodily fluids, such as urine, sweat, and tears. Vision changes, hyperglycemia, and renal failure are not common side effects of rifampin. Question 9. A patient is taking digoxin for atrial fibrillation. What lab test is most important to monitor for toxicity? A. Serum potassium. B. Serum calcium. C. Serum digoxin levels. D. Complete blood count, CBC. Answer: C. Serum digoxin levels. Rationale: digoxin has a narrow therapeutic range, and serum digoxin levels must be monitored to prevent toxicity. Potassium, calcium, and CBC are important, but not the most critical in this scenario. Question 10. A nurse is caring for a patient on high-dose corticosteroids. What is the most important complication to monitor for in the long term? A. Glucose intolerance and diabetes. B. Hyperkalemia. C. Renal failure. D. Weight loss. Answer: A. Glucose intolerance and diabetes. Rationale: long-term corticosteroid therapy can lead to glucose intolerance and the development of diabetes. Hyperkalemia, renal failure, and weight loss are not primary concerns with corticosteroid use. Question 11. A patient is taking a thiazide diuretic for hypertension. Which electrolyte imbalance should the nurse monitor closely? A. Hyperkalemia. B. Hypocalcemia. C. Hypokalemia. D. Hypernatremia. Answer: C. Hypokalemia. Rationale: thiazide diuretics can cause hypokalemia by increasing potassium excretion in the urine. Monitoring potassium levels is essential to avoid adverse effects. Question 12. A patient on levothyroxine therapy for hypothyroidism is experiencing increased heart rate, sweating, and restlessness. What should the nurse assess first? A. Blood glucose levels. B. Thyroid function tests. C. Heart rate and rhythm. D. Serum calcium levels. Answer: B. Thyroid function tests. Rationale: symptoms such as increased heart rate and restlessness may indicate hyperthyroidism or levothyroxine overdosage. Thyroid function tests T3, T4, and TSH should be assessed first to adjust the dose. Question 13. A nurse is caring for a patient on corticosteroid therapy who develops muscle weakness. What is the most likely cause? A. Hyperkalemia. B. Hyperglycemia. C. Osteoporosis and muscle wasting. D. Hypotension. Answer: C. Osteoporosis and muscle wasting. Rationale: long-term corticosteroid use can cause muscle wasting and osteoporosis, leading to muscle weakness. Hyperkalemia, hyperglycemia, and hypotension are not typically associated with corticosteroid use in this context. Question 14. A patient is prescribed amitriptyline for depression. What is the most serious side effect the nurse should monitor for? A. Sedation. B. Urinary retention. C. Anticholinergic toxicity, for example confusion, dry mouth, blurred vision. D. Hypertension. Answer: C. Anticholinergic toxicity, for example confusion, dry mouth, blurred vision. Rationale: amitriptyline, a tricyclic antidepressant, can cause anticholinergic toxicity, which manifests as confusion, dry mouth, and blurred vision. Sedation and urinary retention are common side effects, but are less immediately dangerous. Question 15. A nurse is caring for a patient who has just started on phenelzyne, an MAOI, for depression. What food should the patient avoid? A. Leafy green vegetables. B. Aged cheese and processed meats. C. Fresh fruits. D. Seafood. Answer: B. Aged cheese and processed meats. Rationale: MAOIs like phenylzyme interact with tyramine, which is found in aged cheese and processed meats, leading to hypertensive crises. Fresh fruits, seafood, and leafy green vegetables do not contain significant tyramine. Question 16. A nurse is preparing to administer potassium chloride to a patient on a diuretic. What should the nurse check before administration? A. Serum calcium levels. B. Serum potassium levels. C. Blood pressure. D. Serum sodium levels. Answer: B. Serum potassium levels. Rationale: potassium chloride is administered to replace potassium lost through diuretics. The nurse should ensure that serum potassium levels are within a safe range to avoid hyperkalemia or hypokalemia. Question 17. A patient is prescribed metformin for type 2 diabetes. Which of the following is the most important side effect to monitor for? A. Hypoglycemia. B. Lactic acidosis. C. Weight gain. D. Hypertension. Answer: B. Lactic acidosis. Rationale: lactic acidosis is a rare but serious side effect of metformin therapy, requiring immediate discontinuation of the drug. Hypoglycemia is uncommon with metformin alone, and weight gain and hypertension are not primary concerns. Question 18. A nurse is administering ondansetron to a patient undergoing chemotherapy. What side effect should the nurse be most concerned about? A. Drowsiness. B. Headache. C. Prolonged QT interval. D. Diarrhea. Answer: C. Prolonged QT interval. Rationale: ondansetron can cause QT prolongation, which may lead to serious arrhythmias. Drowsiness, headache, and diarrhea are common side effects, but are less concerning compared to prolonged QT. Question 19. A patient on warfarin therapy has an INR of 4.5. What is the appropriate nursing action? A. Administer vitamin K and hold the warfarin dose. B. Continue the warfarin dose and monitor the patient. C. Decrease the dose of warfarin. D. Give an additional dose of warfarin. Answer: A. Administer vitamin K and hold the warfarin dose. Rationale: an INR of 4.5 is above the therapeutic range, increasing the risk of bleeding. Vitamin K should be administered to reverse the anticoagulant effects, and the warfarin dose should be held. Question 20. A patient is receiving acetaminophen for pain management. What is the most serious side effect the nurse should monitor for? A. Hepatotoxicity. B. Renal failure. C. Gastrointestinal bleeding. D. Hypokalemia. Answer: A. Hepatotoxicity. Rationale: acetaminophen overdose can cause hepatotoxicity, which can lead to liver failure. Renal failure, gastrointestinal bleeding, and hypokalemia are not primary concerns with acetaminophen use. Question 21. A patient receiving lithium for bipolar disorder presents with fine tremors, polyuria, and weight gain. What is the most likely cause? A. Lithium toxicity. B. Hyperthyroidism. C. Diabetes insipidus. D. Renal failure. Answer: A. Lithium toxicity. Rationale: tremors, polyuria, and weight gain are common signs of lithium toxicity, especially if the serum lithium levels are too high. Hyperthyroidism and diabetes insipidus may present with some of these symptoms, but are less likely in this context. Question 22. A nurse is caring for a patient on a combination of warfarin and amiodarone. What is the most important lab value to monitor? A. NR. B. Serum potassium. C. Liver function tests. D. Serum calcium. Answer: AINR. Rationale: amiodarone can increase the effects of warfarin, making it crucial to monitor the INR regularly to prevent bleeding complications. Serum potassium, liver function, and calcium are important, but not the primary focus in this scenario. Question 23. A patient on anticoagulant therapy is experiencing excessive bruising. Which action should the nurse take first? A. Notify the healthcare provider. B. Check the patient's hemoglobin and hematocrit levels. C. Administer vitamin K. D. Apply pressure to the bruises. Answer: B. Check the patient's hemoglobin and hematocrit levels. Rationale: excessive bruising can be a sign of bleeding, so the first action should be to check the hemoglobin and hematocrit levels to assess the severity. Notifying the healthcare provider and administering vitamin K would follow, depending on the lab results. Question 24. A nurse is administering oral iron supplements to a patient with iron deficiency anemia. What side effect should the nurse monitor for? A. Constipation. B. Diarrhea. C. Weight loss. D. Renal toxicity. Answer: A. Constipation. Rationale: iron supplements commonly cause constipation. Diarrhea, weight loss, and renal toxicity are not typically associated with oral iron therapy. Question 25. A patient receiving ampicillin for a bacterial infection develops a rash, itching, and difficulty breathing. What is the most likely cause? A. Hypersensitivity reaction. B. Drug-induced hepatitis. C. Superinfection. D. Renal failure. Answer: A. Hypersensitivity reaction. Rationale: the symptoms of rash, itching, and difficulty breathing indicate a hypersensitivity reaction or allergic reaction to ampicillin, which can range from mild to severe anaphylaxis. Drug-induced hepatitis, superinfection, and renal failure are less likely. Question 26. A nurse is caring for a patient on ciprofloxacin therapy for a urinary tract infection. Which of the following adverse effects should the nurse monitor for? A. Tendinitis and tendon rupture. B. Hyperkalemia. C. Liver failure. D. Diabetic ketoacidosis. Answer: A. Tendinitis and tendon rupture. Rationale: ciprofloxacin, a fluoroquinolone, is associated with an increased risk of tendinitis and tendon rupture, especially in older adults. Hyperkalemia, liver failure, and diabetic ketoacidosis are not primary risks for ciprofloxacin use. Question 27. A nurse is preparing to administer furosemide to a patient with heart failure. What is the most important consideration before giving the medication? A. Serum potassium levels. B. Blood pressure. C. Serum sodium levels. D. Serum calcium levels. Answer: A. Serum potassium levels. Rationale: furosemide is a loop diuretic that can lead to potassium depletion, so serum potassium levels should be checked before administration to avoid hypokalemia. Monitoring blood pressure and sodium levels is also important, but potassium is the priority. Question 28. A patient is receiving high-dose hydrocortisone for inflammation. Which of the following is the most important long-term side effect to monitor for? A. Hyperglycemia. B. Osteoporosis. C. Hypokalemia. D. Hypertension. Answer: B. Osteoporosis. Rationale: high-dose corticosteroids, such as hydrocortisone, can lead to osteoporosis over time due to decreased calcium absorption. Hyperglycemia, hypokalemia, and hypertension are common, but not the most significant long-term effects. Question 29. A patient on ibuprofen for pain relief presents with dark-colored stools and vomiting blood. What is the most likely cause? A. Gastrointestinal bleeding. B. Hepatotoxicity. C. Renal failure. D. Hyperkalemia. Answer: A. Gastrointestinal bleeding. Rationale: ibuprofen, a nonsteroidal anti-inflammatory drug, NSAID, can cause gastrointestinal bleeding, which may manifest as dark stools and vomiting blood. Hepatotoxicity, renal failure, and hyperkalemia are less likely in this context. Question 30. A patient taking phenytoin for seizures presents with signs of gingival overgrowth. What should the nurse advise the patient to do? A. Take phenytoin with food. B. Increase oral hygiene and visit a dentist regularly. C. Reduce the dose of phenytoin. D. Switch to another anti-epileptic medication. Answer: B. Increase oral hygiene and visit a dentist regularly. Rationale: gingival overgrowth is a known side effect of phenytoin, and improving oral hygiene and regular dental visits can help manage this. Reducing the dose or switching medications is not necessary unless the side effect becomes severe. Question 31. A nurse is caring for a patient on prednisone for chronic inflammation. What is the most important side effect to monitor for with long-term use? A. Hyperglycemia and weight gain. B. Dehydration. C. Bradycardia. D. Hypotension. Answer: A. Hyperglycemia and weight gain. Rationale: long-term use of prednisone, a corticosteroid, can cause hyperglycemia and weight gain. Dehydration, bradycardia, and hypotension are not the most significant concerns with prednisone therapy. Question 32. A nurse is educating a patient about taking rifampin for tuberculosis. Which of the following statements by the patient indicates a need for further teaching? A. I should avoid alcohol while taking rifampin. B. My urine may turn orange while on rifampin. C. I should wear sunscreen and protective clothing while outside. D. I can stop taking rifampin once I feel better. Answer: D. I can stop taking rifampin once I feel better. Rationale: rifampin should be taken for the full prescribed duration, even if the patient feels better, to prevent drug resistance. Avoiding alcohol, being aware of the orange urine, and using sunscreen are appropriate recommendations for rifampin therapy. Question 33. A nurse is caring for a patient receiving TPA, tissue plasminogen activator, after a stroke. What is the most important side effect to monitor for? A. Bleeding. B. Hypotension. C. Bradycardia. D. Hyperkalemia. Answer: A. Bleeding. Rationale: TPA is a thrombolytic that can cause serious bleeding, including intracranial hemorrhage. Monitoring for signs of bleeding is the most important aspect of care. Hypotension, bradycardia, and hyperkalemia are not primary concerns with TPA. Question 34. A patient on lithium therapy for bipolar disorder presents with confusion and tremors. What is the first nursing action? A. Check serum lithium levels. B. Decrease the lithium dose. C. Administer a sedative. D. Increase fluid intake. Answer: A. Check serum lithium levels. Rationale: confusion and tremors are signs of lithium toxicity, and the first action is to check serum lithium levels. Decreasing the dose, administering a sedative, and increasing fluid intake are not the first priority in suspected toxicity. Question 35. A patient is prescribed hydralazine for hypertension. What should the nurse monitor for as a potential side effect? A. Reflex tachycardia. B. Hypokalemia. C. Hypercalcemia. D. Weight loss. Answer: A. Reflex tachycardia. Rationale: hydralazine can cause reflex tachycardia as a compensatory response to vasodilation. Hypokalemia, hypercalcemia, and weight loss are not common side effects. Question 36. A nurse is caring for a patient receiving epoetin alpha for anemia. What is the most important lab value to monitor during therapy? A. Hemoglobin and hematocrit. B. Platelet count. C. Serum potassium. D. Blood glucose levels. Answer: A. Hemoglobin and hematocrit. Rationale: epoetin alpha stimulates erythropoiesis, so monitoring hemoglobin and hematocrit is essential to prevent polycythemia. Platelet count, potassium, and glucose are not as critical during epoetin therapy. Question 37. A patient on antipsychotic medication reports experiencing muscle stiffness, fever, and altered mental status. What is the most likely cause? A. Neuroleptic malignant syndrome. B. Serotonin syndrome. C. Hypoglycemia. D. Hypertensive crisis. Answer: A. Neuroleptic malignant syndrome. Rationale: neuroleptic malignant syndrome, NMS, is a rare but serious reaction to antipsychotic medications, characterized by muscle rigidity, fever, and altered mental status. Serotonin syndrome, hypoglycemia, and hypertensive crisis are less likely in this case. Question 38. A patient receiving vancomycin for an infection develops a red rash on the upper body. What is the most appropriate nursing intervention? A. Continue the vancomycin and apply soothing lotion. B. Discontinue the vancomycin and notify the healthcare provider. C. Administer an antihistamine to relieve the rash. D. Increase the dose of vancomycin. Answer: B. Discontinue the vancomycin and notify the healthcare provider. Rationale: a red man syndrome rash is a common side effect of vancomycin when given too quickly, and the medication should be discontinued immediately. An antihistamine may relieve symptoms, but discontinuing the drug is the priority. Question 39. A patient on chemotherapy presents with mouth sores and difficulty swallowing. What is the most likely cause? A. Mucositis due to chemotherapy. B. An allergic reaction to chemotherapy. C. Infection due to immunosuppression. D. Dehydration due to chemotherapy. Answer: A. Mucositis due to chemotherapy. Rationale: mucositis is a common side effect of chemotherapy, leading to painful sores in the mouth. Infection, dehydration, and allergic reactions are less likely to present as mouth sores. Question 40. A nurse is caring for a patient on oral contraceptives who is experiencing breakthrough bleeding. What is the most appropriate action? A. Continue the oral contraceptive and monitor. B. Switch to a different type of contraceptive. C. Instruct the patient to stop taking the medication. D. Recommend over-the-counter iron supplements. Answer: A. Continue the oral contraceptive and monitor. Rationale: breakthrough bleeding is a common side effect of oral contraceptives, particularly during the first few months of use. The nurse should continue monitoring the patient and may consider advising a different contraceptive if bleeding persists. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!